We're going to be talking this morning on our health segment about toothache and how dangerous is toothache? How dangerous can it be? All right, so Dr. Patrick Bannerman-Agbesi has joined us, and he's going to be taking us into the depth of toothache and how bad it can actually get. Good morning, doctor.
Good morning.
How are you doing?
Doing well.
Fantastic. So tell us, how dangerous really can toothache get?
Toothache can kill in extreme cases.
Toothache can kill?
It's possible.
Okay, now you have my attention.
So,
really?
Yes, it can.
Okay, take us to that extreme and then let's go back.
Okay.
Yes.
So toothache can be defined just as pain in the tooth or the gum or any of the supporting structures, okay, which are usually the gum and the bone.
Okay.
Okay. It may start off as an infection for some. It may start off as trauma in other cases. Those are basically the two main forms in which it presents. There are other causes for which, rather academic, but for the purpose of viewers, generally tooth decay and trauma would capitalize on what toothache would bring about. Yeah.
What would be your normal causative factors for toothache? What would you say?
Lifestyle.
Lifestyle.
Basically,
so
lifestyle.
Choices of things we eat.
Choices of things we eat, how we clean our teeth, that's our oral hygiene practices. Generally, those two would take up the bulk of the causes. Yes.
Okay, okay. And in your practice, what's the worst you've ever seen?
Somebody died.
Somebody actually died?
Yes.
Okay, now, what is it that, I mean, I don't see the correlation between toothache and death. So help me understand that.
Okay, so it's a long pathway.
Okay.
But it can be very short in the hospital.
In terms of happening.
In the hospital setting, okay. So we have a culture of living where people really don't take these things very seriously. A toothache is like, oh, it's a little painful. I'll go to the pharmacy, get a quick fix, I'm okay. Yeah. Then it comes back, oh, I stopped chewing on this side. So people tend to manage these things at home, all kinds of home remedies and all that. And then the body will attempt to manage these things. And then it gets to a break point, it's like, okay, I give up.
Wow.
And then it will run its full course. Usually by then, all defense systems have been broken down. Access to healthcare may not be ideal. Funding to actually take care of the situation at a set time would also be limiting. So when you put that mix together and the clients really can't do anything or the patients can't do anything in the hospital or the clinic setting, then it can enter into dire straits. Yeah.
So are we talking about blood poisoning at a point? Sepsis?
Sepsis comes into play.
Okay.
Sepsis comes into play. Okay. Yes.
Okay.
Because when you look at the sequelae of toothache, on the infection side of things, which is generally tooth decay, it starts off as a little lesion somewhere on the tooth. When I say lesion, I mean a cavity. Yeah. Oh, it's painless, I don't feel anything. Okay. It may progress to, oh, when I chew there, then I'm uncomfortable, then I can't chew there. And then the next thing, like, oh, my face is swollen. You know, usually that's a point where they find a health practitioner to try and sort things out. Some would, on the case of, oh, I'm out of finances, would go to a pharmacy and try that out. If they don't have access to a pharmacy, then the home remedy starts. There are cases where people would have put electrolytes from your batteries.
Yes, I heard about that.
Akbeteshin, into that. There's this product called Toothache. I'm not marketing that, but it's a little red. It comes in a little red pack, very cheap. It's usually handed over to people who walk into the pharmacy for that.
I see. What's it supposed to do?
It's not supposed to do anything. It just kills off the tooth. Okay. So now the person has initial relief where the tooth is dead. Okay. So after about 2 or 3 weeks, now the tooth being dead gets to die. So it's rotting away. So then that is where the secondary issue comes in. Then your sepsis comes in.
Sets in.
Yes. And with sepsis, once it's in the blood, it spreads directly from the point contact towards other dependent areas, and then that's when someone can actually pop off. Okay,
so we have some images here, and we want to take a look at them on the screen, and you can help us to walk through and then describe what's happening and what we are looking at. Yeah, so if you can put the images. Okay, so this is a healthy tooth that we are looking at.
Yeah, so that's just a schematic diagram, called from the internet for a healthy tooth. Yeah. We generally see two parts. We see the crown, which you see higher up, and then we have the roots. The roots are embedded in the bone and supported by gum. So that's what generally holds your teeth. Okay. Okay. So for the part of the healthy tooth, which is the crown, we have the inner core, a middle layer, and an outer shell.
Okay.
I mean, there are scientific names for them. So the inner core is called the dental pulp.
Okay.
That's where the life of the tooth is.
Okay.
Blood vessels and nerves.
Okay.
Once there's blood, then you know that there's something being fed to it.
Okay.
And then the nerves will bring you sensation, which is usually pain.
Yeah.
Okay. Then we have the middle layer, which is the dentine.
Yeah.
That's usually your barrier where challenges will pick up and people...
Is the dentine the brown part? The light brown part?
It's the light brown part.
Okay.
So you could look at, let's say, a match box. So if you just look inside the match box and you see how the matches are aligned side by side. But imagine these are straw with a hollow surface to it.
Okay.
So you have some of the endings of the nerves traverse through this to certain layers.
Okay.
So that's like your shock absorber or your organic part of the tooth.
Okay.
So all this is protected by the outer shell, which we call the enamel.
Okay.
Picture the enamel to be sheets of glass, horizontally, placed one over the other, over the other. So it's more protective as a barrier. Okay. So once this is how the normal tooth presents.
Yeah.
So if we move on to the next slide, we'll be able to see that decay, which would usually start as a result of excess food particles remaining on a tooth surface that haven't been cleaned properly, especially at night. If the average adult is sleeping for a minimum of 4 to 5 hours, that's long enough time for your bacteria to have a buffet. Okay. And averagely, everybody sleeps
for
night.
about 4 to 5 hours.
So give or take, you have constant damage being caused to the tooth surface. So if it's just in the enamel, you definitely wouldn't feel much. Your toothpick will be able to yank it out and you're okay. However, once it gets into the dentine, then there are sensitivity or pain issues. For which behaviorally, people just switch to the other side. Oh, I don't chew any longer on this side. I chew on this side. Oh, I can't drink cold water, so I drink regular water.
On the other side.
Exactly. So that's usually how things go. So with the next slide, it will just outline the two main causes for which...
let's look at the next slide.
Let's see the next slide, please. No, I think it's jumped up a bit.
We've jumped,
Yes. So if we could go back about 2 slides back. So generally with that, what happens is, if we could still go back, good. So, yes. So the main causes, as we outlined for purposes of our viewers, would be tooth decay, which we call dental caries. Big word, but it's just more like an infection of the tooth by bacteria because of available food surfaces. And then in some cases also trauma. So with the next slide, we'll be seeing how it starts off. So it might start off as a small lesion. These are real life images of clients that I've seen in practice, and we've been able to pull out these. Of course, most of them have had consent to it. The ones that don't have, we've blotted out their eyes so that it doesn't become a challenge.
Okay.
So, I think we have a bit.
So this is.
Okay, so this is where it starts off at, like the little brown patch on your far left. If I should say the last part, 1, 2, that's the molar tooth.
At the back there.
Yes, right in front. You see
the
brown
front
part
here,
exactly.
the brown part,
So that's where it usually starts off at.
The
infection will tend to spread from within the tooth, that's within the pulp, out of the bone, breaking down bone. Of course, once it gets into the gum, it's very elastic, so it's allowed for a bit of a bulge, which we'll see in the next picture. So that would come out as a little bulge on the side, and that's what you have over there. These are inconsequential. These are for 2 different clients, but I just want us to see the workflow exactly. So there'll be a bulge on the tooth for which there's pain, usually redness, a little bit of a swelling, as we can see there. And then the next screen would show when this bulge gives way. The next screen will show when the ball gives way. A little viewer discretion is
so for our viewers who are watching, just be careful. If you can't stand it, maybe you want to turn your eyes away a little bit.
So generally, for that you have an excess of fluid pouring from the tooth, from the gum, for which the people would usually come in with swollen jaws. Okay,
so the one that you showed us earlier with the bulge in the on the tooth, at the bottom of the tooth. After that, it gets exposed?
It could. It could. So in some people, the pressure held within that gum could actually have a little pinpoints where it would ooze out.
Ouch.
But in certain cases, too, the fluid or the pus, which we call it, can spread along the muscle lines. And usually for that, then you have it going into the more dependent parts of the tooth. So this client would show you that he has a bit of a facial asymmetry, or his face, one
starts
side
to
seems to be a little bigger than that, which has been accentuated by the arrows.
Okay.
So generally with this, then they come in and then we see them. There are more graphic images for extreme cases, but we are on TV and we don't want people to lose touch with the rest of the day or turning off their TV set.
Well, I think that sometimes people too also have to see the reality of what it is that they are getting into.
Very, very gory.
If just if it's as simple as brushing your teeth before you go to bed and you refuse to do that.
Brushing well.
Okay, so talk to us about protecting our teeth, and preventing this kind of horrible things from happening to your teeth.
Okay, so there's one thing that beats it. It might sound very counterintuitive, but everybody's supposed to see a dentist at least twice a year.
Okay.
At least twice a year.
Twice a year?
Yes. Okay. So what happens is that with your regular checks, it's more like a maintenance on your vehicle or in any other thing that you find or you put value on. Nobody would be driving a vehicle for too long without having an oil change or your tire pressures checked because you use it on your daily commute. Same thing, your mouth is being used every day in your chewing, in your speech. Lose a tooth and see whether you can be on set today. It won't happen. You'll probably find the next dentist as close to you as possible. So lots of us have taken, it's like maybe the awareness might not be there or we are not too interested in the general care until we have a situation. So we advise everybody to find a good dentist close by and then just walk in. Oh, I want to have my teeth checked. Okay, most of the time, whatever we find during the conversation or during your examination, we can advise you on. And then we have a plan for you to maintaining your teeth because your teeth are supposed to last you a lifetime. So give or take, that's the main idea.
Yeah. What are some of the typical fixtures or should I say ways of fixing teeth once they are damaged? What are some of the different procedures depending on what the problem actually is? Okay,
so if you look at, depending on the stage with which we have the damage, we can have something as simple as fillings, simple fillings, to complex fillings. We call them root canals and all that. For some
root canals?
Yes.
Okay, tell us about root canals. I'm interested because I'm about to have one.
Really?
Yes. I'm about to have one tomorrow, actually.
Are you excited?
Yeah, I'm ready. I'm ready.
Okay, so with root canals, we're looking at the point where we've had too much damage to the crown of the tooth.
Okay.
For which we've gone beyond enamel, we've gone beyond dentin, and we're in the pulp. So the main idea of a root canal is to disinfect the tooth entirely.
Okay.
Okay, so if you consider how Egyptian mummies were
embalmed. Okay.
Similar concept. So we are taking out the infected part of the tooth, which is the nerves and the blood vessels. Okay. And then we replace it with
a
safe. Oh, it doesn't
sound.
Should I get ready? It's fine. You'd live. You'd live.
Okay.
So we do that, and then we replace that. So the environment that we now create is one of stability, where the tooth is not going to have an infection that is spreading any longer.
Okay.
And then usually, considering the amount of damage that's done to the tooth, which is the crown, it doesn't really help for function moving forward. So we'd have to put some type of prosthesis or artificial stuff on it.
So like an artificial crown?
Like a dental crown to protect whatever work has been done so that you can enjoy chewing your bones and all the things that are important to you. Yes. So generally, that's that.
So I should be able to function normally?
No, you will be able to function normally.
Okay, like in maybe, so after the procedure, like how long before I get to?
Oh, give or take after 24, 48 hours.
I should be okay?
Yes. Because of course once...
So I'm getting the root canal done tomorrow?
Yes.
After my show?
Yes.
Will I be ready? Will I be ready in the next day?
You definitely be.
I should be ready.
You'll be ready for supper, you'll be ready for lunch.
Okay.
Give or take.
Okay, sounds good.
Yeah.
Supper, I need to have supper.
You must.
Okay. Yeah. So sometimes we see people with braces and, and there are different types of braces as well that I noticed. That some that are inside the mouth itself and some are that on the surface. Yeah. What are all these things and how do they play in terms of tooth care and all that? What do they do? What are they for?
So I'll tread cautiously on this because that's in the line of specialists. Who we call them orthodontists. But I'm just a general practitioner. I might have some interest in that, but I'll try and do that for you. So the thing about braces is that it's meant to align teeth.
Yeah.
Okay. For some people, they have concerns with, my teeth are crooked. Prematurely, maybe when they are much younger, teeth were pulled out when they weren't supposed to. So the final formation of how the permanent teeth come out is not very exciting to them. So with the concept of that, there's some I mean, we've actually not moved, but there's a transition from the metal braces that you actually see to invisible braces.
Oh, okay.
So people could actually have treatment ongoing and you probably
wouldn't ever know.
Yes.
Wow.
So for the ones that are behind the tongue, that's for maybe corporate people. You don't want everybody to know you're having active treatment. Okay. So we call them incognito. Okay. So it hides behind the tongue and closer to your tongue. So that's what holds everything together. Of course, for the bulk or the majority of such cases, you have them up in front. For them, they would have more guidelines towards care. Because you have foreign bodies more or less attached to every tooth. Okay. So plaque accumulation. Plaque is just extra deposits of bacteria and food mixed together. Okay. So they are kept on a strict oral hygiene protocol to maintain overall health. Okay. These treatments may span a minimum of 2 years for some cases. Some complex cases would span a little longer. So that's generally what braces would be aiming to do.
So we see cases of motor accidents, you know, and sometimes there's pretty bad damage. You can see the jaw is broken. Are you able to reconstruct in such a way that the person can function normally in a case of an accident or bad damage of teeth? You know, how well are we able to reconstruct so that the person can live a really reasonably regular life?
That is very, very possible. Okay. Usually for those who have road traffic accidents, usually motorbike riders who don't have a full helmet, have the half face or no helmet at all. What happens is that's usually in the line of a specialist, another specialist. We call them the maxillofacial surgeons. Okay. Big word, just people who tend to reconstruct your jawbone. Sometimes plates. Yeah. We use metallic plates to realign jawbones. For those who have lost...
So you embed plates in their face?
We embed plates in their bone.
On their bone?
So it's kind of like fixing it side by side to make it stable. Okay. Most of the time we engage the laboratories to fabricate artificial teeth. Even sometimes you can fabricate artificial structures of the mouth, gum and bone, to replace significantly...
areas that they've lost.
Significantly deformed faces. And they tend to manage quite well post-trauma, yes.
Wow. Okay, so we have a few pictures that we want to put up again, and then we'll just take a look at them and then talk us through what we are seeing.
Okay, so this tends to happen a lot in the average young male. Okay. Small boys running around, stop it.
Okay, and they don't mind their mother when she's shouting.
Are you in pain? No. Then in the next 4 years, the tooth is changing color. Okay. Parents don't know what is going on. Okay. They might tell you there's a little gum swelling on top or not, and then the attention of those who are primary caregivers are engaged. And this happens in a lot of people playing football, basketball, without mouth guards. It's important that we consider that anytime you have a chipped tooth, no matter how small it is, just pass by a dentist and have it checked out. You may never know how far and that will fall under the trauma for which we discussed prior for that. Yes. Okay. So also these are just pieces of...
These are extracted teeth?
Exactly. Okay. Viewer discretion is still advised. Yeah. So on the far back on the left, you see very... Okay. Yeah. So those are extracted teeth from somebody who probably didn't need them. Yes. So they had multiple teeth come out on one side of the tooth, and most of the time to encourage or let them know that everything came out. Yeah. It's good to show them like, oh, there's a little piece. No, I brought everything out, as we can see.
Can they still eat normally?
They would recover well depending on how healthy they are. Okay. So the average healthy adult would take about 5 to 7 days to recover. For which we would ask them to chew on the other side. Okay. So the challenge usually comes about when there are problems on both sides, but some decisions can't be taken in such situations. Yeah. So
the other one that we saw, the open mouth. If we can take a look at that one again with the open mouth.
Yes. So with that, you see the last but one tooth on the left.
Yes.
There's a bit of a gape.
Yes.
Okay. Yes. And you see these yellowish deposits.
Those on the right of our screen.
Yes, on the right of our screen. So that's a badly broken down tooth. I mean, the caries or the decay is far advanced. Yeah. For which then we are more likely to have a gum swelling anytime soon. Okay. And then the person would present. Okay. Obviously, because of that defect, they are not able to chew properly on that side. So food tends to accumulate more on that side of their mouth.
Okay.
And then they would have to come in for sessions of cleaning.
Okay.
Also, we call scaling and polishing.
Okay.
Yes. So at any point in time, you might have this in your mouth.
Yeah.
And you would not
know that it's there.
Because it's probably gone past pain. You've managed it with over-the-counter antibiotics and painkillers from time to time. So what we have there is a black spot on the last but 2 teeth. That's the first molar tooth.
Yes.
It's one of the first adult teeth to come into anyone's mouth.
Okay.
Just after 6 or 7 years.
Okay.
So it tends to have quite a long span of use.
Oh,
so most of the time, if there are challenges with the molar teeth, they may start off there.
Yeah, okay.
Also because when we are much, much younger, our oral hygiene practices are a bit challenging if you've tried monitoring teeth.
Kids don't like brushing teeth well, yeah.
Yes. So that's a black cavity that we see there. It's sometimes an indication of how long the carious lesion has been there. For some also, they may be arrested. We call them arrested because the active decay began. They may be as a result of some oral hygiene practices or modification of behavior.
Yeah.
The person brushes more frequently now, may rinse after a meal to reduce the amount of food particles there. So then the place tends to blacken out.
Okay.
But there are some extreme cases where in much older times we had some type of fillings. They were the like metallic fillings.
Yes.
We call them amalgams.
Yes, I've had some done.
Yeah, then you probably haven't seen the dentist way back. Yeah, so most of the time these would tend to have that black appearance.
Okay.
There's a new concept where people just go and replace them with tooth-colored fillings.
What are we seeing
So
here?
that there would be something that will fall under trauma. So generally, because of the way people initiate toothbrushing, which is usually a back and forth, very rigorous movement, you tend to wear away some parts of the gum and expose some parts of the dentine under the tooth. So someone like this would come in telling you, when I drink cold water, for 4 to 5 seconds, I'm in excruciating pain. And then it just levels off. Okay, so this will fall under trauma, for which if we do come in earlier, we can have it patched up. And
that one there with the exposed teeth, is that what is referred to sometimes as gingivitis? Or
gingivitis is inflammation of
the gum.
Okay, so people would have that when they tend to brush in the mornings, and you realize there's a tinge of blood in the froth of your toothpaste.
Okay.
Usually people go a little aggressively, but they realize that after they have a rinse out, the blood ceases to flow.
Okay.
So that's just an indication that gum diseases is about starting, for which the deposits that are sitting next to the gum irritate it.
Okay.
Okay. So the concept would be that more blood with defense systems will be sent to the gum in an attempt to clear the deposits which are outside.
I see.
Distending the gum a little bit. So any trauma, then you begin to bleed.
Okay.
So for that, your biannual or your annual visits for your scaling and polishing, which is cleaning,
would take care of that.
Would get rid of that, and then you'd be on your way to better good health. Yes.
Okay. If let's talk about the practicality of visiting the dentist regularly. How much would it cost to do just like what you said, like a scaling and cleaning? Averagely, I mean, give us a range.
Is this a trick question?
No, it's not a trick question.
It might not apply to my practice.
No, exactly. Just give us a range so that we have an idea for the viewer who's watching. If I need to do 2 visits a year, what are we talking about?
This might be difficult to tag because there are some that are national health insurance.
Okay.
Okay. There are some private insurance companies who also tend to have a cap for that. It's usually...
But NHIS takes care of cleaning?
I can't... I have to update myself on that.
Okay.
I happen to be in private practice, so I am a little far from that. Okay. So most of my clients are cash clients and insurance holders. But it will be difficult to put a price tag on that, also depending on who's having the procedure done. Okay. So we have dental hygienists. Okay, so they have been trained to... So
they're not dentists necessarily?
No. They are trained as oral health professionals.
Okay.
And then they have been given some allowance to have some of these relatively simple ones done also. Okay. So based on the facility, the skill set of the professional, the quality of equipment you're using, and of course, in the business and your overheads and all that, you factor out a price that is affordable to whichever stream of clientele you're dealing with. So I would not be able to put a price tag to that. Okay. But I mean, there are several clinics popping up everywhere now.
Yeah.
So I think anybody can walk in and you can make that inquiry, and then you can be sorted out.
Okay.
Yeah.
So any final thoughts to people who are struggling with toothache? You know.
Well, the main thing is that your teeth are supposed to last you a lifetime. I think we just have to pay a little more attention to them.
Okay.
Okay, because most of the conditions that occur for which people come to us on our daily are preventable. Okay, so we're moving from the curative, which is more of operation-based, to education and then prevention. Because if I encourage you to behave in a certain way, you are less likely to come in with such diseases or such conditions. So we just ask everybody to find a good dentist close by. Just pay a visit. Oh, I want to have my teeth checked. Maybe if there's anything, any advice. And then that can be done. If you intend to have treatments afterwards, that's your decision to take. But I think everybody is entitled to that information.
All right. Thanks, Patrick. So we've been speaking to Dr. Patrick Bannerman-Agbesi, who is a dentist at the Sam J Specialist Hospital in Hacho on the Ekomog Road.
Hi guys, I hope you enjoyed this video.
Subscribe to our YouTube channel, the Citi TV,
for exclusive breakfast daily content and other Citi TV programs.
Like, comment, and share with your friends.